Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
We've already talked tonight about mistrust of institutions' perceived elites. Perhaps the most dangerous form that mistrust can take is found in the anti-vaccination movement. The problem's become so severe that it's been declared one of the major threats to global health by the World Health Organization. Tomorrow, politicians and public health workers from around the world will gather for the first ever global summit dedicated to asking how vaccine hesitancy can be solved. In a moment, we'll discuss whether more should be done to make parents immunise their children. First, our health correspondent Deborah Cohen looks at the roots of the crisis.
The reluctance to vaccinate. It's been described as a global crisis and one of the top 10 threats to health. In many parts of the world, diseases that should be preventable with a vaccine have seen a resurgence. Measles, for example, has seen a 30% increase in cases globally.
The European region of the World Health Organization currently recommends that 95% of the population are immunised against certain illnesses preventable with vaccination. In the UK, these vaccines start in childhood and include jabs against MMR and illnesses such as polio, pertussis, diphtheria and tetanus.
But vaccination rates in many parts of the UK are below what they should be. Health Secretary Matt Hancock has recently refused to rule out, following in the footsteps of Italy and France, which have introduced compulsory vaccinations. This graph shows the uptake of the 2 doses of the MMR vaccine and another which protects against 6 diseases. Its commercial name is Incorrigible. Over the last 10 years, England's vaccine coverage in children has been consistently lower than Scotland, Wales and Northern Ireland. Professor Heidi Larson, who runs the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine, says the reasons for the differences are complex.
I think when you've got a larger population overall, a much larger population, much bigger urban populations, and urban populations in general are more mobile, London in particular.
Coverage differs across England as well. If we look at the uptake of the MMR vaccine, only 20 out of the nation's 149 local authorities hits that target figure of 95% coverage. The north of England has amongst the highest rates of uptake. In London, however, the vaccine uptake rates are the lowest in the country. No local authorities hit the target of 95% coverage. Hackney has the lowest rate in the country at 75%.
There's a lot of different languages, there's people have different understanding, some people have, may feel uncomfortable or that they weren't treated nicely at a clinic.
It isn't as simple as parents having ethical or cultural issues with vaccinations. Some vaccines require more than 1 dose to be as effective as possible. For example, these data suggest that children may miss out on the second MMR jab and pneumococcal vaccine. The uptake rates seem to be lower second time around. One explanation for this is that people might think they're protected after 1 jab. Communication that more doses are needed may need to be improved. So how much of a role does the so-called anti-vaxxer movement play?
What people refer to as the anti-vaccine movement is actually a very small proportion of the public. I think what was a bigger issue is the mainstream hesitancy and questioning and uncertainty. We always want to talk about the benefits versus the risks, emphasizing the benefits. But parents are comparing risks and risks, which is actually technically probably a more accurate thing to do. And when they look at the potential risks of a vaccine, as rare as they may be, compared to the risks of a disease that they don't really see anymore, the focus is going on the risks of the vaccine.
Given the complexity of the situation, will Matt Hancock be minded to introduce compulsory vaccination or keep the status quo?
That was Deb Cohen there. We're joined now by Helen Bedford, Professor of Children's Health at UCL's Great Ormond Street Institute of Child Health, and by Dr. Eleanor Drager, a sexual health doctor and medical writer. It's interesting to hear Deb's explaining that it is more to do with mainstream tendency than to do with an anti-vax movement, a sort of conspiracy movement. Nevertheless, do you think that it is important to make these vaccinations mandatory now? Should Matt Hancock go the way of Italy and France?
So my stance on that is that we should go part way to the way of Italy and France and perhaps model the Australian system, which is where you're not allowed to go to nursery or school unless you've had all your vaccinations. So you still have choice to not vaccinate, but that means that you can't send your child to school.
And you might end up with a lot of kids at home.
You might do. They would still need to be educated, but they would be educated at home.
What do you think?
I would be very concerned about that because I think it would lead to inequity. Because inevitably, if you're well off, you just pay for a private tutor if you don't want your child to be vaccinated. But if you're poor and you don't want your child to be vaccinated, then your child is further disadvantaged by not having an education. So I think it's very concerning, the idea that we would penalise people for not vaccinating.
It is also quite defeatist, isn't it, to say you can choose not to vaccinate your kid. I mean, this isn't about individual rights of parents. This is about herd immunity. Either everyone does it or it doesn't work.
Well, in this country we have very high rates of uptake. Over 90% of children are vaccinated and vaccine confidence is high. And the people that don't get vaccinated or don't get fully vaccinated tend to be those who have difficulty accessing services. So what we need to do is make it easier for parents to get their children vaccinated.
Why wouldn't you make it against the law? Why wouldn't you go the way of donor cards, for example, you know, and say you have to actually register to not be vaccinated? You have to say you don't want to opt out. I mean, why wouldn't you just assume that every child was vaccinated?
You can't assume that every child is vaccinated because some of them would have a medical reason to not be vaccinated. So there has to be an exemption. But my argument would be that there would be a medical exemption as opposed to a religious or a philosophical exemption to vaccination. And when I know you talk about vaccine confidence being high, but at the same time, we've just recently lost our measles-free status.
Is that in this country?
In this country, in August.
They wouldn't be presumably having a global summit if there wasn't a problem.
Yes, exactly. So measles cases in this country are on the up. And although overall vaccination rates are high, over 90%, the rate of the second vaccination is only 87.2 or 87.4%, which is not enough for herd immunity. It needs to be above 95 to be for us to have herd immunity, and we don't have that currently.
But the fact that 95% of children have had one dose by 5 years suggests it's not about vaccine refusal. It's about difficulty accessing or just needing to be reminded that you need to have that second dose before you go to school.
So you think it's actually a sort of, I don't know, a sort of hesitancy or a...
Or simply that people lead busy lives. You know, if you've got several children, we know from the research that if you've got more siblings, you're less likely to be immunised. And this is all because people have busy lives, and it's practical reasons often that stop children being immunised.
That does change the whole narrative. It's not about conspiracy then. It's not about what people read on the web. It's not about a movement that's taken hold then. You don't...
So I think it's about all of those things put together, and that's why you need to have a multi-pronged approach. You can't just increase access and you can't just increase education. You also need to include quasi-mandatory vaccination. That's what I would argue.
Thank you both very much. Thanks for coming in.